Hi everybody, my name's Dr. Cara and I'm a chiropractor. Today I'm going to show you ways to relieve neck pain that can occur during pregnancy and postpartum. Neck pain usually occurs because of changes in our posture. When we're pregnant, we're trying to really deal with all the change in the weight that's in the front of our body. And the one way that's going to look like is as our pelvis or as our stomach grows, we're going to notice that our pelvis will roll forward like this. And oftentimes our neck will start going forward like this as well to compensate for that change. The other time during postpartum that we see a lot more neck pain and discomfort occur is when we're looking down at our baby, either rocking them, feeding them with a bottle, or even breastfeeding. While neck pain is not normal, we are able to do things at home to help relieve some of the tension that we're experiencing. I'm going to go over a stretch, ways to help strengthen the neck so that it doesn't keep occurring, and then something relaxing to do at home that will help recreate more of that ear over shoulder curve in our neck. The first thing we're going to start with is going to be the basic stretch. So the biggest thing that we'll see with that type of tension for people is that a lot of tension will go from the side of the neck down into the shoulders. To stretch this area, you're going to look to one side, you're going to drop your ear, and then grab the other side of your head and pull gently on the side of the head there down. And I like to walk the opposite hand down my leg like this. You can hold it for 60 seconds to 90 seconds and then release. That's going to be a great way to help stretch it deep into the neck here and then into the shoulder as well. The reason why our head will lean forward like that and let our ear kind of shift this way is because the muscles in the front of our neck get really weak. And so we can strengthen the muscles in the front of our neck through what we call a cervical retraction exercise. The way you can do this at home is you can either use a towel or a band to help create this type of banded distraction that we need. So I'm going to show you guys with a band and with a towel. So I'm going to take this towel and I'm going to wrap it around the band once just to create some padding for the back of my neck. Once you've done that, you're going to make sure that the handles are going to be nice and even. This is going to come to the back of the neck like this. And your hands are going to grab the bands on the side. You're going to apply some pressure going front to back like this. And the first step you're going to do is you're going to drag, or we call it closing the drawer, where you're taking your chin and you're pushing it straight back. The reason we do this is because it strengthens the deep cervical muscles here and stops your head from coming forward. So you're going to drag them in, press your band away, and then you're going to look up and back. You're going to hold it for 1 second and come back to center. Again, you're going to tuck your chin in, press the band away, and then look up and back. This will help strengthen your neck so that it isn't so far forward and it's coming more over ears over shoulder and help combat some of that time that you spend looking down at baby. The next thing we're going to do is going to be more of a relaxing way to relax at the end of the day, and I would definitely encourage after feeding baby to spend some time in this position. You're going to take a towel and roll it up into a circle. You're going to lay it down. You can do this either on the bed or on the floor. You're going to place that rolled up towel underneath your neck, and you're going to drape your neck over it so it's creating almost like a bridge or like a orthotic for the neck when you're laying on the ground. You're going to lay there for 10 minutes, and when you come up, you're going to roll to your side and then press yourself up. The reason we do this is because it helps create more of a curve or a lordotic curve in the neck, and that's going to be much better for your posture and feel so much better for your neck.